Hey, everybody. Welcome to the Eat, Pray, Faith with Tracy Straub podcast. My name is Dr. Tracy, and I'm a traditional naturopathic doctor. You are in for an amazing treat today because with me is Dr. Jill Taylor, and she is not only an amazing practitioner, but she comes from a very interesting field, which is dentistry. And so I'm going to give you a little bit of background on Jill Taylor. You're like alphabet soup behind your name, so you can probably go over this, but I'll link Jill's bio in the details of this podcast because you're going to want to read it. Jill Taylor graduated from the Community College of Southern Nevada in '87 with an associate degree in dental hygiene. She later received her bachelor's of science in technical management from DeVry University, graduating summa cum laude, and is also a certified health specialist and certified nutritional consultant. She has worked in clinical practices as a RDH for over 36 years, retiring from the exceptional dental practice in Las Vegas to pursue her independent in-office consulting full-time in 2010. She worked with Premier Laser in 1997 and became certified on 3 different laser wavelengths. Well, that's interesting. She was a hygiene program director until 22 at an influential postdoctoral dental teaching institute. Jill continues as an independent educator on behalf of Waterpik since 2013. Dr. Jill brings her passion and expertise to the dental teams across North America on the comprehensive treatment planning for the dental patient, including restorative, occlusal, medical risk, sleep apnea, oral cancer, detox, and periodontal health. In addition to being a published author, Jill is an accomplished international speaker who presents on topics including molecular testing, restorative communication and acceptance, myofunctional therapy, nutrition and detoxification in dentistry, oral systemic link, biofilm therapy via air polishing, and laser-assisted periodontal therapy. In 2017, she passed the American Naturopathic Medical Certification Board and is now a doctor of naturopathic. As an ND, she enjoys bringing holistic health awareness to her clients, working with them through detox protocols to achieve their health goals. So Dr. Jill is also part of my telehealth team, and I have to say, this is going to be amazing. Our topic today is the mouth is the window to your health, which I know we put some emphasis on it, but just from the small amount I've learned from you in the, couple of years that I've known you, I have to say I'm completely blown away by what you can see, do, and actually the health you can attain by overcoming issues of your mouth, not only bacterial, but structurally as well. So, Jill, love to hear how you got into holistic health from dentistry. Give us a little history here.
Well, dentistry has always been very, say, tunnel visioned, right? To just what they see. And in my time at this postdoctoral teaching facility, we really took in the patient as a comprehensive look, like what's going on in here. They always say, your eyes are the window to your soul, but truly the mouth is the window to your health. So anytime we have dis-ease, which is the term I got from you, I really knew that if I saw anything amiss in here, it was impacting right down into our rest of our body. And so in my studies, we never talk about that in the academic end of it. So one of the owners of this company said, well, you're really into nutrition. You should look into a nutritional master's. And I thought, okay, I'll go get a nutritional master's. So in that, I looked at it and it just wasn't jiving with what I wanted. And so that's where I found you at Trinity. And I really, with my previous husband's background of chiropractic care, because I put him through chiropractic school, I really kind of got a much more holistic, how can I say, venue in my background, because dentistry is so toxic. And I think with everything that's kind of pushing forward with GMOs and, the degradation of our nutrition, I think dentistry is finally seeing that it's impacting our overall health and that people want that holistic solution, the whole fluoride thing and, radiation and oh my gosh. And So the Trinity just really resonated with me. So I ended up getting the holistic side of a very, how can I say, rigid Western medicine side, because for dentistry, it's always, drill and fill. And that's all I did. And they put something so toxic in the mouth that the FDA puts all these stipulations about how they come pick it up from the dental office. Right. So I think it was just kind of a natural progression for me, because I wanted my patients healthy on the inside, and I wanted that mouth gum to be healthy. So that's how I kind of found you. And of course, I'm going to share with everybody that you did fail me.
Well, I'm going to share with everybody on our last presentation together. She told me I had an overbite. So, so
It's like,
also
I forgot.
in looking grades. That's right. I was like, oh, I do? You fail. No, I'm just kidding.
Right.
I only failed you because you were using disease terms, and we don't
Right.
believe in that. We believe in dis-ease, which is
Right.
nutritional deficiency or toxicity. But this is really good. So I just want to position this lecture because I think in our industry of natural health, and for people listening here today, they're going to wonder, is like, are they going to talk about fluoride as a neurotoxin? Are they going to talk about amalgam fillings and mercury in the mouth and heavy metals? No, we're not talking about that today.
Right.
We could, but it is talked about. What I want to talk to you about today is a few things that we started out with. Number one, you were telling me earlier that structurally, you can look at the structure of someone's mouth and basically, I don't want to say predict, but have a good idea of some current health issues that they're having and even maybe some health issues in the future. So let's just use me as an example since I'm right here. And I do believe she said that I have a beautiful smile, but I'm no Julia Roberts. So I think that's what I heard.
You did.
So go ahead and talk to that point about what you were saying prior to us getting on this podcast about structure of the mouth and how important that is.
Well, the structure of the mouth starts in infancy, right? I mean, the baby's born without teeth, but the teeth are there, the baby teeth, and then the adult tooth buds are there. So when we start just in infancy, we're trying to get that arch in formation. And while you do have a beautiful smile, you don't have that full, big, rounded smile like Julia Roberts. So we don't see any dark back to the backs of her mouth, because all you see is teeth, right? Or Donny Osmond if you're a male, whichever. You have the Osmond smile. And so what a lot of people don't understand is sometimes our arch formation and how our teeth touch can create something that you said it fixed when you went into a retainer, right? What did you
Right.
tell me it fixed? Your
My TMJ. Yeah. So earlier this year, my son went in and got braces. He's 14. And we
Mhm.
waited as long because I wanted to give his mouth time to form. And my son has one of those beautiful rounded smiles. His
Right.
teeth were just spaced out and he has a nice big mouth. I always tell him. So does my younger son. They get it honestly. You know what I mean? But
Right.
I was having an issue with the left side of my jaw. And the girl that I happened to go to, I've known her since she was a child. Her father actually did my braces earlier on when I had 4 little brackets because I had an overbite. So nothing structurally fixed, just basically pulled them in alignment. Long story short, she said to me, she said, your one tooth is prominent. And I said, yeah, I know. And she said, we could fix that. She's like, do you want me to make you a retainer? And so she did. And what I noticed about the retainer is that it doesn't fit on the roof of my mouth. It's almost like suspended. So it was
Mhm.
really uncomfortable at first, like to sleep in, because it seemed to be like expanding my teeth on the top, and I couldn't like close my mouth. Like there was no place for my teeth to go. So I went back to her and I was like, this is super uncomfortable. And she was like, that's because that's how your mouth was probably supposed to be. But like you were saying earlier, the roof of my mouth was too high. So
Right.
that has been about, I don't know, about 5 months that I've had it. Has, done a lot of cosmetically straightened out the front of my teeth, which weren't really crooked, but they were just disproportionate a little bit. But moreover, it took away the pain in my jaw. So it was shocking and very relieving too, because it was to the point where I would open my jaw and it was a major cracking sound, which isn't there anymore. So go ahead, tell me about that.
So what ends up happening with bites that are like you had ortho, and back when we were getting ortho, they didn't take into consideration the jaw joint, right? And the tooth position. They just wanted to make you pretty. And they did. As I said, they gave you a beautiful smile.
Don't try
But
to
then,
make it.
but then what ends up happening is they take the braces off, right? And you probably wore a retainer for a little while, and then the retainers get lost. And now your body looks at that and goes, you know, I really don't like where my teeth are positioned. So your teeth start moving to become harmonious with your jaw joint and your muscles and your tooth, right? So that's why it moved, because your tongue didn't know where to go. And that's part of it, because with that really high arch, your tongue was supposed to be up there, but it wasn't when you were younger for whatever reason, right? It was low on your palate, which is why you ended up getting a narrower arch and more of an overbite, right? And that dentist then just created the look, but he didn't take in consideration where your jaw joint and your teeth want to hang in space with where your muscles are. So now what they're doing is they're trying to create that harmony by widening up your jaw a little bit, gives your tongue a place to go as soon as they're done, right? And then what ends up happening is that also decompresses your joint. So your joint is supposed to hang, right? I should do it this way. Sorry. Your joint's supposed to be hanging. And when you, I don't want to say like we're getting older, but when your bite isn't perfect and you're clenching a lot because you're in athletics, right? And we tend to clench when we concentrate, that compresses that joint up there. And that's where you get the TMJ pain, right? Or the clicking and the popping when you open your mouth. And so what that ortho is doing is trying to create that. Well, back in the day, we had orthodontists that wanted to pull teeth. And there are some rare instances where you need to, but the how can I say the standard of care back in the day, and there's still universities that are teaching this. They'll pull out all four bicuspids of our children's teeth. Now, like your son had this beautiful round arch, but if you have a kid that's teeth are all jumbled, right? Their orthodontist will go, well, just to make them straight and beautiful, we'll pull these teeth and we'll give space for it instead of expanding the jaw, like, right? Because they just didn't have that training, right? That's not what they taught in dental school. They taught it just to pull. So, and when you have your babies, if you're not looking at that baby and going, okay, we need to breastfeed. Well, maybe you can't breastfeed. Maybe they have a tongue or lip tie that they don't latch, that maybe the lactation specialists missed, right? I've had lactation specialists miss tongue and lip ties. So the baby doesn't latch properly, so that you give them a bottle. When they're bottle fed, now you're forcing the jaw to go back. You're teaching an improper swallow, right? And so that child now has a spit swallow. So when we're feeding children with the spoons, we're going, look what's coming. Here comes whatever, here comes the airplane. And you're making them open and take it from a spoon at a like baby food. That creates an improper swallow. Those improper swallows create an improper tongue placement. And so you are creating then that collapsed arch, which is, I don't want to say you have a collapsed arch, but it's not the ideal.
Oh, you can
right?
say it's just live. That's okay.
Yeah,
Now
it's
I
just
feel
live.
like a horrible
Right.
mother and I have a collapsed arch. So good.
You know what? And I had my daughter's tonsils removed, right? Because if children have really big tonsils, it throws the tongue forward, right? And so 30 years ago, that's what we did. We removed the tonsils to give the tongue space, but we didn't teach the tongue where to go. And so my daughter still had a low tongue posture, or I should say an over tongue posture. She put her tongue over her arch on the bottom and ended up with an underbite. Right. And her dad had one. And so I'm trying to prevent that. Right. And I didn't know what I didn't know. Right. So she was bottle fed. Because I was an athlete and busy working mom, and and I had the tonsils out at 7, and she still grew into it. So it's really important that we start young, right? If we can, we breastfeed, we watch for colic and allergies, which I know you've talked about. Babies are supposed to have their mouth closed. Children are supposed to have their mouth closed. They're supposed to be 100% nasal breather. We are supposed to be. I mean, God gave us a nose.
Let me ask you this question. Yeah, and I always say this: the nose is the highest sense that we have.
It is.
It's above the mouth. It usually saves us from, not eating something that'll kill us. So when you say these kids, let's say they're open mouth breathers, let me ask you this. We waited as long as possible for John to get braces. I don't know if that's a mistake or not. And I heard from you prior to getting onto the podcast, I want to clarify this. There are orthodontists, but there are also trained dentists who do what you're talking about with structural alignment. So can you first make that differentiation from what kind of dentistry is this that you're talking about and that you're involved in compared to going to an orthodontist who does braces? And I'm not downing either side. I want to know the difference.
Right.
And I want to know, how early do you embrace structural alignment issues, and which side do you choose for that?
Okay, so that's a two-part question. Totally a two-part question. So in dentistry, there are two camps of occlusal philosophy of how you fix somebody's bite, right? And how you address that. So on one hand, there's what we call CR, which would be like dentists and if you look on dental websites, like your dentist website, you'll see, I went to Pankey and I went to Christensen, or they will have what we call a physiological bite, which is kind of like what I talked about, wanting the joint, muscles, and teeth to be in harmony, right? So that physiological occlusion is another camp, all right? And you don't get that one in school, okay? So that one has to be learned postdoctoral, which is where I was teaching. So you've got both of those camps warring on. Now, the dentists that were trained in physiological dentistry, a lot of them understand occlusion, so they will do things like, i.e., Invisalign, right? So they won't do the traditional brackets, but they're trying to widen your arch so that we don't have future maybe sleep apnea issues, right? And they aren't really big in extractions. And then you have another group of doctors, which we will call your biological dentists, right? And you have that term running out there. And biological dentists, what their philosophy is a safe way of removing amalgams. Okay, it has nothing to do with bite. Okay, that's the biggest key. They have nothing to do with bite. Now, you might have some bite doctors, whether they're CR, centric relation, or they're physiological dentistry. Either of those may have the holistic dental, biological dental, which they have gone through, like the SMART technique protocol, right? That's what it's called. You want to use a rubber dam. You want all dentists have high speed suction. You don't need something that's really like incredibly high speed, but they're afraid of the aerosols and, when you're removing amalgams and stuff. But it's more what you do before you have the amalgams out, right? And it's their protocol. So you have that. Now, when you asked me about
youngest, the structural alignment.
The structural thing. So how young do you start? That's kind of based on what you're seeing. I mean, you could do myofunctional therapy. I've seen 3-year-olds with an underbite. Okay. But gosh, a 3-year-old, right? Do you start braces at 3? No, right? So if you have a really like a significant thumb sucker, right? And they have an overbite, right? Real narrow arch. We would do something like myofunctional therapy with a myofunctional therapist, right?
Mm-hmm.
You work with them prior to going into ortho because you want to make sure that they don't have any noxious habits, non-nutritive habits. Like my husband's son had a horrible overbite, and he was a sneaky breather because he was a mouth breather. So he would take his pencil with the eraser, wooden pencil, and he would write, he would get bite marks in his eraser, like to the point where he bite off the eraser. But he would do that unconsciously because he was trying to breathe.
Okay.
You'll see women who will like try to be really sexy and they'll, hold their, it opens
I'm
up.
trying to be sexy. I said
Right.
I'm
Right.
trying to.
Right. Yeah, choose something. Right. So, but those are sneaky breathers, right?
Okay.
And so when you think about trying to fix somebody at what age, I've seen 68-year-olds in full-on braces, like brackets.
Mm-hmm.
Sometimes you need a bracket depending on how severe their arch is. You can't do it with Invisalign. Not all cases can be Invisalign, right? But when do you start? You start as early as possible. You want them evaluated. And some orthodontists, depending on their occlusal training, some will say, oh, I want all the permanent teeth in. And some will say, no, I want you to start myofunctional therapy because it'll make my job easier. If you have an orthodontist that has kept your kid in braces for like 4 years, 5 years, he's
Right.
not aware of where that tongue is going. And he doesn't have a myotherapist in his community or online that he's associated with to fix that swallow, because it's the swallow that keeps the bite open, which is why they can't close the bite, which is why they've been in ortho for 4 or 5 years. And so you have those cases out there. So once again, they're trying to make them beautifully straight, but those kids are going to end up as a 40-year, 30-year TMJ issue, right?
Yeah.
So if you get TMJ issues post-ortho, which a lot of people do, now you've got to start thinking, okay, they're making me beautifully straight, right? But they're not taking into into how the joint and the muscles are all into play. Does that make sense?
It makes great sense. So when you have these structural misalignments, besides TMJ, which I think is, not deadly, but
Oh, it's not, but it can be incredibly debilitating. I mean,
yeah.
incredibly.
You talked about breathing issues. What other things, just high level, you don't have to go into each one, but what are some of the issues that can arise from a misalignment of the mouth or bite?
So you can get periodontal disease with bone loss. You can get, for sure, decay, because if their tongue isn't working right, they can't clean their mouth properly. Definitely we can see, well, I said perio, tooth, just like breaking teeth, right? People that end up with like they're chipping teeth, cusps fall off, right?
What about breathing issues?
Breathing issues, you can totally tell in the mouth. I mean, just doing a simple malampati, right? I mean, and as naturopathic doctors, we can do that, right? All you're doing is you sit up straight, stick out your tongue, and look. And if you see tonsils, you don't see an airway, right? So Dr. Malampati was an anesthesiologist, right? And what he did is he created this scoring system on how fast you could be intubated in surgery. So he would look in your mouth before he put you under, and you were sitting up straight with your tongue out, right? And he would look to see how big that space was. And so if your space is really small, he knows that you might have an airway issue when you're under anesthesia. If you've got, you can drive a Mack truck through it, right? Then he thinks, you're going to be pretty good. Well, what they found research wise is people who had like class 1 or 2, they are going to have more propensity for sleep apnea.
Yeah.
So
So
just
sleep
looking at
apnea,
that, I can see that.
we know
Correct.
can lead to cardiovascular issues, congestive heart failure issues,
Correct.
lung issues. So instead of a CPAP, they might just need to go to a practitioner like this who can look at their bite, a physiological dentist,
Yep.
and maybe realign their bite to help them with breathing, as
So,
well as some other things that we know, like inflammatory factors and sinuses and
oh,
things.
absolutely.
That's
I mean,
where complementary care comes in.
I know it is. I mean, it takes a village to get a patient healthy, right?
Yeah.
It really does. It takes a village, and you want all of them on your team. And to your point, I had a autistic young man who was 16, nonverbal, very aggressive. And his mom was getting more and more concerned because he was a big boy. I mean, he was like 210 at 16, big. And she's like this little thing. She's like you, little tiny thing. And we started talking, and she showed me a picture of him. And I said, how is he sleeping? I said, what's his sleep patterns? And she's like, oh my gosh. She goes, I think he's sleeping fine. And I said, well, I said, looking at his mouth, I said, I want you to just take him to a dentist and see if the dentist would recommend a sleep study for him. So I sent him to a dentist who I knew was into all this. And the dentist sends him to the sleep study. The kid couldn't do the first night. They actually had to medicate him to get the sleep study done. He was having every 45 seconds, he was having an aura, right? So an arousal. And the mom comes back and she goes, I want you to know you saved my son's life.
Aw,
So what they ended up doing is they ended up opening up his bite through like a neuromuscular ortho. And
nice.
she ended up moving to Utah, and they sent her to a guy up there who could do it. And now he's almost done. He's sleeping better, right? So, when you
Well,
catch
he's
these,
not as grumpy, so he's not as aggressive because he's getting some.
absolutely, absolutely. And now the
Training. Yeah.
nutrition can actually be absorbed, I mean, it's all of it. So, you don't think, oh my gosh, my dentist can save my life, right? But as a holistic practitioner, we have to be so aware. And when you go to the MD, the Western medicine doctor, he doesn't look in your mouth, right? I mean, they might, like, if you have a sore throat, okay, now they're swabbing you for strep. That's about the duration of an MD, right?
Right.
And your dentist is really an oral physician that should be able to encompass that. But not all dentists are made the same. And then they are so constrained with insurance,
Mm,
and in the holistic health world, we don't work with insurance. And
right.
in my 30 years of being in clinical dentistry, I didn't work with insurance. My dentists were all off insurance plans. So what they recommended was their standard of care, not the insurance standard of care. And it really, for us as lay people going to the dentist, everyone's all like, oh my gosh, does my insurance cover it? Well, that shouldn't be your first concern. You want to know, does my doctor recommend what's going to be in the best interest of my health, right? Is he
Right.
screening for sleep apnea? Is he screening for oral cancer? Is he talking perio, right? I mean, what is he recommending for restorative? I had a great friend in dentistry that was still placing amalgams. And he goes, well, Jill, he goes, that's all people can afford. I'm like, great, but are you educating them that for an extra $100, they could have something that's non-toxic and
Right.
it's not going to hurt the tooth? I
Mm,
mean, that's really what it is. I mean, amalgams break your teeth. I mean, forget about the mercury. You're going to get an implant. I mean, seriously. So, I mean, it's all about, you got to have the discussion with the patient, you know, what's the best thing in your health, and then, do some of it, all of it, or none of it, but treatment plan it so that they can afford it, right?
no,
Because
that's a great point. It's like what we do at the telehealth group, right? What can you
yes,
do? What will you do? And what can you afford to do? And we base your plan on that.
right.
So, with the time we have left, you were going to talk a little bit about just high level. And guys, just so you're aware, there's going to be some classes coming up with Dr. Jill she's going to teach this just wide open, how to look at the mouth, what all you can find out, discover bacterias, all of these things in the Academy of Abiding Wellness. So we're really excited. I'll post some links in the details of this podcast about that. We might have some pre-registration going on. It's also going to be part of our designation that we're going to be offering to healthcare professionals and people that want to become healthcare professionals, because this is a vital part of education, and you're going to have to train our team too. So tell us a little bit about
You wanted the high level. You wanted the high level. So we talked about TMJ.
Yeah.
We talked about ortho. We talked about perio, right? So the bacteria, there's an actual test the dentist can do. So it's not like, well, you have disease. Well, I can prove that you have disease. I can prove that you have an overgrowth of bacteria in your mouth, right? So if your gums bleed even just a little bit, we have that bacteria that has now been introduced somehow into your mouth. And it's just like, how we get like a yeast infection downstairs, right? And what is a yeast infection downstairs? It's an overgrowth of an opportunistic bacteria because the healthy flora is no longer populated. Well, when you have, and I showed you the one from Oral DNA. There's a couple of others out there that just test your spit, right? And that can tell us whether or not you have gum disease. There's other saliva tests that can tell whether or not you have a propensity for decay. There's another test that's saliva that tests for your inflammatory markers and your susceptibility to those bugs, right? And gum disease and heart disease and diabetes, because they're all linked, and Alzheimer's and pancreatic cancer. And we can go down the rabbit hole of that. Wow. You also asked, what can you see in the mouth? And that would be deficiency, right? And so, you've talked about, face
mapping.
Facial mapping. When the Chinese did like the tongue, right? You can see that on the tongue. And I always tell, I live in Vegas, which is of course the desert. And so, when you look at our sand, it's cracked and fissured, right? Because of the lack of water. So when you see fissures on the tongue, we know that is a huge deficiency, right? In just minerals in general, right? When you see, the tongue, different colors, we could have a thyroid problem. We could have, a metabolic problem. We could have an overgrowth of candida. We could have a lack of, enzymes, of probiotics. We have that's just all of that high level stuff that we can go dive deeper into in our upcoming class.
We're going to. It's going to be fun.
I think so.
I know what I want to know.
Okay, what do you know?
How do you go about picking a dentist? What am I looking for?
Ooh, that's a good one. So, you know what? It's asking the dentist the right questions, and it's not even the dentist, because, I've been teaching dentists and hygienists since 1997 about how to speak to their patient. And most of the time when we are talking to the dentist, the hygienist is like, Tracy, you have a little bit of bleeding and you're laying on your back, right? You don't see anything in the mouth, right? They don't take pictures and show you the bleeding. They don't show pictures of your teeth, So how do you pick a dentist? You want someone who's going to educate you, who's not afraid to talk to you. And I would even submit that the team is not even afraid to talk to you, because you'll learn more from the assistants and the hygienists than the dentist a lot of times. The dentist doesn't have time to talk. You'll spend more time. You'll see the hygienist, 2 to 4 times a year, right? Everybody wants to go to the dentist that's on their insurance, which is all well and good.
I blew that up. That we don't even talk about insurance here.
Yeah, it's a hard thing. I would go to someone who's not on insurance. Find somebody in your group of friends and family and the name that pops up, right? And ask the doctor, how do you treat gum disease? What's your rule on treating, an amalgam? Do they offer all porcelain? Do they offer implants? What's your, you have to ask the doctor specific questions, and know what you want your answer for, right? Are you recommending x-rays every single year? What's your x-ray thing? And I have to say, you've got to allow your doctor to be the one that says what he needs. I mean, if you're a 68-year-old on lithium, you're on an antidepressant, your mouth is uber dry, and if you stink with your home care and you've got all this plaque, you're going to get a lot of decay. Well, if you tell me I can't take x-rays, I can't see what's going on inside your tooth. And now you're going to get mad at me when you come at me with a root canal because I couldn't prevent it for you. So allow me to take some x-rays. I mean, if you fly, you're getting a full mouth of x-rays every time you take a flight.
TSA, you're getting a full x-ray. So I get it.
Yeah, but you get patients that are holistic that go, don't take x-rays. And you're like, well, I've got to be able to do something. And then go to Desbio and get Radistat, right?
Right, that's right. We'll put the link for that in the comments. Radistat, write it down.
Right. I mean,
here's
there's ways to detoxify, but we got to do what we got to do. So you've got to do
within our circle, Jill. They know they want no fluoride. They don't want the mercury fillings. We have kids with MTHFR, can't do the nitrous oxide.
God, I hate nitrous.
There's some considerations, right? That initially people are getting kind of influenced on and schooled a little bit about what to look for in a dentist. But what I'm hearing is I'm looking for somebody that has training beyond normal dentistry, things in the physiological dentistry or the biological dentistry, the SMART protocol. And when you go in and you have goals for yourself, so mine would be like alignment, right? So I'm going to seek out a physiological dentist versus a biological. Now, I do have some mercury fillings left, and it's just about time and process of when you can get those removed. In life. And until then, you can do things that help.
That guard helps. So that guard helps. Okay. So
finish us off here with some tips.
So for me, I really love my LVI dentist, Las Vegas Institute for Advanced Dental Studies. Those dentists are physiological, but not all LVI dentists are made the same. So, I mean, I would reach out to me because I know what they've taken. I know I can do some research on that. And then there are some doctors that have gone through like Spears and Cloyce. I mean, if they've done some of those really high level occlusal, or if they've, put on their website that they've gone to AOSH, they're members of AOSH, or, looking at what they are members of shows you the level of education that they've done out of dental school, right? They didn't let the dental school hit them in the butt on the way out, right? Yeah. Which is why, like, you're always teaching, and which is why, we're always taking courses to learn. Just because you have DDS or DMD at the back of your name doesn't mean you know everything. So looking on their website and knowing, what are they members of? What have they done since dental school, right? Yeah. You want that. Right? You want that. I'm not as big on the SMART protocol because we in the naturopath world know how to detoxify mercury. And if you're going to go get a mercury filling, if you go to an LVI dentist, they use rubber dams. Well, 99% of your dentists don't use rubber dams, and they should, right? If they're removing mercury. So
it shouldn't be removing mercury without giving you a protocol. So
right.
One of the things that I'll do is get those resources from you, and I'll link what are we looking for on websites that are like, here are the 5 things. I think that's important. But as for today, this has been incredible information. So Jill is part of our telehealth team. She's on the website. I'll link her direct scheduling bio. some of the things that I would recommend that people come to Jill specifically for is if you have battled Lyme in the past and you're now experiencing oral decay, which is huge with post-Lyme infection. Those are people that I think would benefit so tremendously from you, because I see so many of them myself, and that's where they are. I mean, and they end up with extensive dental surgery because it's just been so long. And I think you can either help them or direct them to the right people. And then anybody else that just has questions about natural health in general, because Jill's an incredible holistic practitioner, but also oral health in general. I think probably that's going to be.
I mean, once you're in the oral health realm, all over, like I was just listening to, our last, because I can't always get on you live, but for our last 365, where you were talking about gut health, right? And that starts in the mouth, guys. It starts in the mouth. So anytime you're trying to fix gut, you've got me, because we go from here to here to all the way to the end. So it starts in the mouth. It really does.
Well, Jill, you're amazing. Thank you for being here. I so
Thank you for having me. This was fun.
Well, we're going to bring you back because I have so many more questions, and I'm sure everybody does. So you guys can leave a comment on this podcast for Dr. Jill. I'll make sure she sees it or gets it. She can turn in and look at those too. Make sure you make an appointment with her. She's a wonderful practitioner. You will not be sorry. And watch for her upcoming classes. We're going to do some for the lay people and also for practitioners to enhance your skill, because it is true. All health begins in the gut, which is the GI system, which is tip to tail, mouth to butt. So don't forget it. Thank you so much for being here, and God bless you guys. And we will talk to you soon and see you next time.
Thank you.